Have you ever wondered if your body gives warning signs weeks or even a month before a stroke happens? The answer might surprise you. Your body is constantly sending signals, and recognizing these early warnings could be the difference between life and death. Every year, more than 795,000 people in the United States suffer a stroke. That's one person every 40 seconds. Stroke kills nearly 159,000 Americans annually, making it one of the leading causes of death and long-term disability in the country. But here's what most people don't know. Many stroke victims experience subtle warning signs days or even weeks before the actual event occurs. These signs are often dismissed as minor health issues, fatigue, or simply getting older. By the time the stroke happens, it's often too late to prevent serious brain damage. Today, we're going to explore 7 stroke symptoms that can appear as early as 1 month before a stroke occurs. Understanding these warning signs could save your life or the life of someone you love. Before we dive in, let us know in the comments where you're watching from and if you've ever experienced any unusual symptoms that concerned you. Don't forget to like this video and share it with your family and friends. This information could literally save lives. Now, let's get started with the 7 warning signs your body sends before a stroke. Warning sign number 1, persistently elevated blood pressure. Let's start with one of the most critical yet often overlooked warning signs, persistently high blood pressure. Blood pressure measures the force your blood exerts against the walls of your arteries as your heart pumps it throughout your body. When this pressure remains consistently elevated, a condition known as hypertension, it creates enormous stress on your blood vessels. Over time, this constant pressure damages the delicate lining of your arteries, causing them to narrow, weaken, or even rupture. Think of your blood vessels like garden hoses. When water pressure is too high for too long, the hose can develop weak spots, bulges, or eventually burst. The same thing happens inside your body with high blood pressure. A groundbreaking study published in the journal Hypertension followed over 30,000 adults for 20 years and found that individuals with uncontrolled high blood pressure had a 220% increased risk of stroke compared to those with normal blood pressure. That's more than double the risk. High blood pressure contributes to stroke in 2 primary ways. First, it can cause a hemorrhagic stroke, which occurs when a weakened blood vessel in the brain ruptures and bleeds. The constant pressure on weakened vessel walls eventually causes them to burst, flooding the surrounding brain tissue with blood. Second, high blood pressure damages arteries throughout your body, making them more susceptible to the buildup of fatty deposits called plaque. This process, known as atherosclerosis, narrows the arteries and reduces blood flow to the brain. If a piece of plaque breaks off or a clot forms in these narrowed arteries, it can completely block blood flow, causing an ischemic stroke. Research from the American Heart Association shows that reducing systolic blood pressure by just 10 points can decrease stroke risk by up to 44%. That's why monitoring and managing your blood pressure is absolutely critical. If you notice your blood pressure readings consistently above 140/90, this is a red flag that demands immediate medical attention. Don't wait. Schedule an appointment with your doctor, and if necessary, start treatment to bring those numbers down. Many people live with high blood pressure for years without symptoms, which is why it's called the silent killer. But in the weeks leading up to a stroke, some people experience more noticeable spikes, sometimes accompanied by headaches, dizziness, or a feeling of pressure in the head. Managing blood pressure requires a multi-pronged approach. Reduce sodium intake to less than 2,300 milligrams daily. Maintain a healthy weight, as excess body weight forces your heart to work harder. Exercise regularly, aiming for at least 150 minutes of moderate activity per week. Limit alcohol consumption and avoid smoking entirely. If lifestyle changes aren't enough, your doctor may prescribe medication. Don't view this as a failure. View it as a life-saving intervention that protects your brain and prevents a devastating stroke. Warning sign number 2, excessive and unexplained fatigue. The second warning sign is excessive fatigue that seems to appear out of nowhere. This isn't the normal tiredness you feel after a long day at work or a poor night's sleep. This is a profound, overwhelming exhaustion that doesn't improve with rest. A study conducted at Wayne State University Medical School interviewed stroke survivors and found that nearly 40% reported experiencing unusual fatigue in the month leading up to their stroke. Women were particularly likely to report this symptom, with some describing it as feeling like they were moving through thick mud or carrying extra weight. Why does this fatigue occur? When blood flow to the brain becomes compromised due to narrowed or blocked arteries, your brain doesn't receive adequate oxygen and nutrients. Your brain is an incredibly energy-demanding organ, consuming about 20% of your body's total oxygen supply, despite representing only 2% of your body weight. When oxygen delivery decreases, even slightly, your brain has to work much harder to perform normal functions. This increased effort translates into profound fatigue. You might find yourself needing to sit down frequently, struggling to complete simple tasks, or feeling mentally foggy and slow. This type of fatigue is often a warning sign of transient ischemic attacks, commonly called TIAs or mini-strokes. A TIA occurs when blood flow to part of the brain is temporarily blocked, usually by a small clot that quickly dissolves on its own. According to research published in the journal Stroke, approximately 15% of major strokes are preceded by a TIA, and nearly half of these TIAs occur within the week before the major stroke. The fatigue associated with TIAs represents your brain's cry for help, signaling that blood flow is being intermittently compromised. If you're experiencing unusual, persistent fatigue that can't be explained by physical exertion, lack of sleep, or other obvious causes, don't dismiss it. This could be your body's early warning system telling you that something is seriously wrong with blood circulation to your brain. Other symptoms often accompany this fatigue, including difficulty concentrating, memory problems, or a general sense of mental sluggishness. These cognitive changes occur because your brain isn't receiving the fuel it needs to function optimally. Warning sign number 3. Sudden vision problems. The third warning sign involves your vision. Sudden changes in vision, whether blurry vision, double vision, or partial vision loss, can signal dangerous circulatory problems in the brain. Your eyes are incredibly sensitive to changes in blood flow. The retina, the light-sensitive tissue at the back of your eye, requires constant oxygen and nutrient delivery to function properly. When blood flow is compromised, vision problems can develop quickly. A comprehensive study published in the British Journal of Ophthalmology examined over 1,600 stroke patients and found that 10% experienced vision problems in the days or weeks before their stroke. These visual disturbances range from temporary blindness in one eye to seeing flashing lights or experiencing tunnel vision. One of the most concerning vision problems is called aneurysms fugax, which means fleeting blindness. This condition occurs when a small clot or piece of plaque temporarily blocks the artery supplying blood to your eye. People describe it as a curtain or shade being pulled down over one eye, lasting anywhere from a few seconds to several minutes before vision returns. Aneurysms fugax is a medical emergency. Research shows that individuals who experience this symptom have a 20% chance of suffering a major stroke within the next 3 months if left untreated. The temporary blockage in the eye's artery often indicates similar blockages are developing in the artery supplying blood to the brain. Double vision, medically known as diplopia, can also signal an impending stroke. This occurs when the muscles controlling eye movement don't receive adequate blood flow, causing the eyes to become misaligned. The brain then receives 2 different images, creating the sensation of double vision. Blurred vision or difficulty focusing can result from reduced blood flow to the visual processing centers of the brain, located in the occipital lobe at the back of the skull. When this area doesn't receive sufficient oxygen, your ability to process visual information becomes impaired. A study from the University of Texas found that sudden vision changes, particularly when affecting only one eye, were present in 8% of ischemic stroke patients in the week before their stroke occurred. If you experience any sudden vision changes, especially if accompanied by other symptoms like headache, weakness, or speech difficulties, seek immediate medical attention. An ophthalmologist or neurologist can perform tests to determine if these vision problems are related to compromised blood flow to the brain or eyes. Don't wait to see if vision problems resolve on their own. Even if they do, the underlying cause, whether narrowed arteries, small clots, or other vascular problems, remains and continues to threaten your brain. Warning sign number 4. Sudden and severe headache. The fourth warning sign is a sudden, severe headache unlike any you've experienced before. While not all headaches indicate stroke risk and not all strokes are preceded by headaches, certain types of head pain serve as critical warning signs. In ischemic strokes, headaches can result from the obstruction of blood flow causing pressure changes and inflammation in the brain. These headaches are often described as sudden onset, severe intensity, and different in character from normal headaches. In hemorrhagic strokes, which involve bleeding in the brain, the headache is typically described as the worst headache of one's life. This thunderclap headache comes on suddenly, reaching maximum intensity within seconds to minutes, reaching maximum intensity. A study published in the journal Cephalgia examines headache patterns in stroke patients and found that 17% of ischemic stroke patients and 34% of hemorrhagic stroke patients experienced new or unusually severe headaches in the days leading up to their stroke. The mechanism behind pre-stroke headaches involves several factors. As blood vessels narrow or become blocked, the brain experiences reduced oxygen delivery, triggering pain signals. Additionally, when blood vessels are damaged or leaking, the surrounding brain tissue becomes inflamed, causing intense pain. Witnesses to stroke events often report seeing the affected person suddenly grab their head, with an expression of extreme pain, sometimes crying out before losing consciousness. This dramatic presentation is particularly common in hemorrhagic strokes caused by ruptured aneurysms. A brain aneurysm is a weakened, bulging area in the wall of a blood vessel in the brain. Before an aneurysm ruptures, some people experience what doctors call a sentinel headache. This warning headache occurs when the aneurysm leaks a small amount of blood before the major rupture occurs. Research from the International Subarachnoid Aneurysm Trial found that approximately 30 to 50% of patients with ruptured aneurysms recalled experiencing an unusual headache in the weeks before the rupture. Many dismiss these warning headaches as migraines or stress-related tension headaches. The key characteristics that distinguish a potentially dangerous headache from a normal one include sudden onset reaching peak intensity rapidly, severity described as the worst headache ever experienced, accompanying symptoms like neck stiffness, vision changes, nausea or vomiting, or altered consciousness, and unusual location or character different from your typical headaches. If you experience a sudden severe headache, especially if accompanied by neurological symptoms like confusion, weakness, vision problems, or loss of consciousness, call emergency services immediately. Time is critical. Every minute of delayed treatment increases the risk of permanent brain damage or death. Warning sign number 5. Sudden numbness or weakness affecting body extremities. The fifth warning sign involves sudden numbness or weakness affecting the extremities, particularly on one side of the body. This symptom can manifest during transient ischemic attacks and serves as one of the most reliable predictors of an impending major stroke. The American Stroke Association reports that approximately 240,000 Americans experience TIAs annually, and about one-third of these individuals will go on to have a major stroke, with half occurring within the first year after the TIA. Numbness or weakness typically affects a single body part, such as one arm, one leg, or one side of the face. This occurs because strokes and TIAs usually affect specific areas of the brain that control particular body regions. Since the brain's right side controls the left side of the body and vice versa, damage to one side of the brain causes symptoms on the opposite side of the body. A landmark study published in the New England Journal of Medicine followed 1,700 TIA patients and found that those experiencing motor symptoms like weakness or numbness had a significantly higher risk of major stroke within 90 days compared to those with other TIA symptoms. The mechanism behind this weakness or numbness involves interrupted blood flow to the motor cortex or sensory cortex of the brain. The motor cortex controls voluntary movements, while the sensory cortex processes touch, pressure, and position information from throughout the body. When blood flow to these areas becomes compromised, the affected brain areas can't function properly. Electrical signals from the brain to the muscles become disrupted, causing weakness. Similarly, sensory signals from the body to the brain become impaired, causing numbness or tingling sensations. Many people describe the sensation as their arm or leg falling asleep, but unlike normal paresthesia from sitting in an awkward position, this numbness doesn't improve with movement or position change. Some report a heavy feeling in the affected limb, as if it's weighted down or doesn't belong to them. Facial drooping, medically termed facial palsy, occurs when the muscles on one side of the face become weak or paralyzed. This is tested using the FAST acronym used by emergency responders: face drooping, arm weakness, speech difficulty, time to call emergency services. Research from the Mayo Clinic found that individuals who experience temporary weakness or numbness have a 10-fold increased risk of stroke within the next 90 days compared to the general population. This dramatic increase in risk underscores the critical importance of seeking immediate medical evaluation. Even if these symptoms last only a few minutes and completely resolve, they should never be ignored. The temporary nature doesn't indicate safety. It indicates warning. Your brain is showing you a preview of what could happen if the underlying problem isn't addressed. Treatment following a TIA often includes blood-thinning medications, blood pressure control, cholesterol-lowering drugs, and sometimes surgical procedures to clear blocked arteries. These interventions can dramatically reduce the risk of a subsequent major stroke. Warning sign number 6: speech and communication difficulties. The sixth warning sign involves sudden problems with speech and communication. This can manifest as slurred speech, difficulty articulating words, or inability to form complete sentences. Speech problems before a stroke fall into several categories, each indicating damage to different areas of the brain. Dysarthria involves slurred or slow speech caused by weakness in the muscles used for speaking. Aphasia involves difficulty understanding language, finding words, or expressing thoughts caused by damage to the brain's language centers. A comprehensive study published in the journal Neurology examined pre-stroke symptoms in 2,416 patients and found that 12% experienced speech difficulties in the 24 hours before their stroke, making it one of the more common warning signs. The brain's language centers are primarily located in the left hemisphere for most people, particularly in areas called Broca's area and Wernicke's area. Broca's area controls speech production, the physical act of forming words. Wernicke's area controls language comprehension and word selection, often resulting in nonsensical or jumbled speech. Research from Johns Hopkins University found that individuals experiencing sudden speech difficulties have a 5-fold increased risk of stroke within the next 48 hours if left untreated. Family members often notice speech problems before the affected person does. They might report that their loved one is talking strangely, using wrong words, or not making sense. Sometimes the person experiencing the symptoms feels frustrated because they know what they want to say but can't get the words out correctly. Speech difficulties during TIAs typically last from a few minutes to several hours, then completely resolve. However, the resolution doesn't mean the danger has passed. The underlying cause, whether a partially blocked artery or small clots, remains active and continues threatening the brain. One particularly concerning pattern involves progressive worsening of speech problems over days or weeks. This gradual decline can indicate slow, progressive narrowing of a major brain artery, setting the stage for a major stroke. Testing for speech problems involves several simple checks. Ask the person to repeat a simple sentence like, "The sky is blue." Listen for slurred words or incorrect word substitution. Ask them to name common objects. Difficulty with this task suggests problems with word retrieval. If you or someone you know experiences sudden speech difficulties, even if brief, seek immediate medical evaluation. Brain imaging can identify blocked or narrowed arteries, and treatment can be initiated to prevent a major stroke. Warning sign number 7: neurological problems including balance issues, memory problems, and confusion. The seventh and final category encompasses a range of neurological symptoms that can appear days or weeks before a stroke. These include loss of balance or coordination, difficulty walking, memory problems, sudden confusion, nausea and vomiting without obvious cause, and changes in consciousness or alertness. Balance problems occur when the cerebellum, the brain structure responsible for coordination and balance, doesn't receive adequate blood flow. The cerebellum is located at the back of the brain and is supplied by the vertebral-basilar arterial system. A study from the University of California examined 856 stroke patients and found that 6% experienced isolated dizziness or balance problems in the week before their stroke, with many dismissing these symptoms as inner ear problems or simply getting older. Memory problems before a stroke can range from mild forgetfulness to significant confusion. These occur when the hippocampus and other memory-related structures don't receive sufficient blood flow. Research published in the Journal of the American Medical Association found that individuals with vascular cognitive impairment caused by reduced blood flow to the brain have a 9-fold increased risk of stroke. Sudden confusion or disorientation can indicate reduced blood flow to the frontal lobes, which control executive function, decision-making, and awareness. People might become confused about time, place, or familiar faces. They might have difficulty following conversations or making simple decisions. Nausea and vomiting can occur when the brainstem, which controls automatic functions like nausea reflexes, becomes affected by compromised blood flow. These symptoms are particularly common in strokes affecting the back of the brain. It's important to note that many other conditions can cause similar symptoms, including migraines, seizures, low blood sugar, infections, brain tumors, and anxiety. This overlap makes diagnosis challenging and underscores the importance of comprehensive medical evaluation. Research from the American Stroke Association emphasizes that any sudden neurological symptom, even if it seems minor or resolves quickly, warrants immediate medical attention in individuals with stroke risk factors like high blood pressure, diabetes, heart disease, or smoky history. Understanding the difference between ischemic and hemorrhagic stroke. Now that we've covered the 7 warning signs, let's clarify the 2 main types of stroke, as this understanding helps you recognize different symptom patterns. Ischemic stroke accounts for approximately 87% of all strokes and occurs when a blood clot blocks blood flow to part of the brain. These clots can form in several ways. Thrombotic stroke occurs when a clot forms directly in a brain artery, usually due to atherosclerotic plaque buildup. Embolic stroke occurs when a clot forms elsewhere in the body, often in the heart, then travels to the brain. A major cause of embolic stroke is atrial fibrillation, an irregular heart rhythm affecting over 6 million Americans. Research published in Circulation found that atrial fibrillation increases stroke risk 5-fold. The irregular heartbeat causes blood to pool in the heart chambers, where it can form clots that then travel to the brain. Hemorrhagic stroke accounts for about 13% of all strokes and occurs when a blood vessel in the brain ruptures and bleeds. This bleeding creates pressure that damages surrounding brain tissue. Hemorrhagic strokes are often caused by uncontrolled high blood pressure, which weakens vessel walls over time, or brain aneurysms, which are bulges in weakened blood vessel walls. Both types require immediate emergency treatment, but the treatments differ dramatically. Ischemic strokes are treated with clot-busting drugs like TPA or mechanical clot removal. Hemorrhagic strokes require procedures to stop the bleeding and reduce pressure in the brain. Understanding brain aneurysms and their warning signs. Brain aneurysms deserve special attention as a cause of hemorrhagic stroke. An aneurysm is an abnormal bulge or ballooning in a blood vessel wall. Over time, this weakened area can rupture, causing devastating bleeding. Most aneurysms don't cause symptoms until they rupture. However, larger aneurysms, or those that leak small amounts of blood before rupturing, can cause warning symptoms, including severe localized headache, vision changes, especially double vision, facial pain or numbness, dilated pupils, and pain above and behind the eye. Research from the International Study of Unruptured Intracranial Aneurysms found that aneurysms larger than 7 millimeters have a significantly higher rupture risk. Family history matters significantly. If a first-degree relative has had a brain aneurysm, your risk increases fourfold. Screening for aneurysms involves imaging tests like CT angiography, MR angiography, or cerebral arteriography. If you have a family history of brain aneurysms or stroke, discuss screening with a neurologist, even without symptoms. Critical steps for stroke prevention. Prevention is always better than treatment. Here are evidence-based strategies to reduce your stroke risk. Control blood pressure. Keep it below 140/90, ideally around 120/80. Monitor it at home regularly. Manage diabetes. High blood sugar damages blood vessels. Keep HbA1c below 7%. Maintain healthy weight. Obesity increases stroke risk by 22%. Even a 10-pound weight loss can significantly reduce risk. Exercise regularly. Aim for 150 minutes of moderate activity weekly. Walking, swimming, or cycling all count. Eat a brain-healthy diet. Focus on fruits, vegetables, whole grains, lean proteins, and healthy fats. The Mediterranean diet reduces stroke risk by 30%. Avoid processed foods, excessive sugar, saturated fats, and sodium. Limit alcohol. More than 2 drinks daily increases stroke risk. Quitting smoking. Smoking doubles stroke risk. Quitting reduces risk by 50% within 1 year. Manage cholesterol. High LDL cholesterol contributes to plaque buildup. Statins and dietary changes can help. Get quality sleep. Poor sleep increases stroke risk by 30%. Aim for 7 to 9 hours nightly. Regular checkups. See your doctor annually for blood pressure, cholesterol, and diabetes screening. Know your family history. Genetic factors matter. Inform your doctor about family stroke history. What to do if you experience warning signs. If you experience any of the 7 warning signs we've discussed, take immediate action. Call emergency services immediately. Don't drive yourself to the hospital. Note the time symptoms began. This information is critical for treatment decisions. Don't eat or drink anything. You may need emergency procedures requiring an empty stomach. Take a list of current medications with you or have someone bring it to the hospital. Stay calm. Anxiety can raise blood pressure and worsen the situation. Remember the FAST acronym. Face drooping. Ask them to smile. Does one side droop? Arm weakness. Ask them to raise both arms. Does one drift downward? Speech difficulty. Ask them to repeat a simple phrase. Is speech slurred? Time to call emergency services. If any symptoms are present, call immediately. Research from the American Heart Association shows that patients who arrive at the hospital within 3 hours of symptom onset have significantly better outcomes. Some treatments are only effective within this narrow window. At the end, stroke is a medical emergency that kills or disables millions each year. But the good news is that your body often provides warning signs weeks before a major stroke occurs. By recognizing these 7 warning signs, elevated blood pressure, excessive fatigue, vision problems, severe headache, numbness or weakness, speech difficulties, and other neurological symptoms, you can seek timely medical intervention that could save your life. Don't ignore these warnings. Don't wait to see if symptoms improve. Don't assume you're too young or too healthy to have a stroke. Take every unusual symptom seriously, especially if you have risk factors like high blood pressure, diabetes, heart disease, or family history of stroke. Knowledge is power, but only if you act on it. Share this information with family and friends. It could save a life. Now, we want to hear from you. Have you or someone you know experienced any of these warning signs? What symptoms concerned you most? Share your experiences in the comments below. Your story might help someone else recognize their own warning signs. Thanks for watching, and remember, when it comes to stroke, every second counts.